Hello, butterflies! Today we are going to dive into the world of cosmetic labeling and manufacturing, specifically talking about how the government controls your skincare labels and how it decides what is allowed to be put on them or not. Specifically, we're going to talk about the FDA. The Food and Drug Administration is the branch of the government that deals with this. They take on things such as prescription drugs and medications, cosmetics that you find over the counter, and of course food and sunscreens. And in today's video, we're going to specifically discuss what this means for you in the realm of acne products and in sunscreen and cosmetics, etc. So the FDA, the Food and Drug Administration, is there to protect you. They are the ones who create guidelines so that if there is a potentially harmful substance in a product, you are only using a therapeutic grade dose if it's a drug. If you're using a cosmetic, this prevents the cosmetic company from making crazy claims like this is going to grow your eyelashes and you're going to be able to fly away on wings. Does anyone remember when Red Bull got in trouble? Said Red Bull gives you wings? Well, Red Bull was actually sued because Red Bull didn't give anybody wings. But that is how serious the government is about these labels. And this is great because it protects us. But unfortunately, some of those laws are very old. We're talking 1980s, 1950s, 1938, and they haven't been updated. And as new advancements in medicine and science and technology come to play, the government is not recognizing all of these as quickly as they need to. For instance, we now have specific medications or specific non-harmful natural substances that we know work very well, been proven by medical literature. But as according to the FDA, because it's not on their fancy list, we cannot call that a therapeutic product, or we cannot say that it does XYZ. So let's actually break this down a little bit more, because this really gets into two main categories. There's over-the-counter, there is cosmetic, and there's RX. Now, RX is drugs. So for instance, a prescription that you get from the doctor. Not really going to talk about that today. What we're going to focus on are cosmetics and OTC products, over-the-counter. Now, if you want to learn how to read your labels, understand what the ingredients are, if they're going to break you out or not, what that means for you, and how much of them there are, we actually have a video on that I'll link you to. This is going to discuss more the reasoning and the limitation and the business behind the beauty when it comes to all this. So let's start by defining the differences between cosmetics and over-the-counter products. A cosmetic is defined by the FDA as a substance that is meant to beautify skin. Now, I'm also saying this off the top of my head in a park, sitting next to the lake, battling the wind and potential helicopters, not verbatim. So just take that with a grain of salt. And I can link you to the description and the actual definition if you want it. But a cosmetic is something that is meant to be applied, sprinkled, rubbed into, plastered on to the skin in order to beautify, in order to enhance appearance, or in order to enhance attractiveness. So essentially, a cosmetic is something that you can put on to enhance beauty, as they say at the FDA, and then it's something that gets wiped off. It does not change the biological system of humans or animals. So for instance, it doesn't change how the cells turn over or the DNA in our skin, as an example. So a really good example of that would be a mascara. This is a mascara that you put on and you take it off. This mascara is not claiming to make my eyelashes longer. It is not claiming to grow more eyelashes. Just a regular mascara, fine. This is where OTC comes in. Over-the-counter is an over-the-counter drug. And again, if it follows their regulations of only certain ingredients and only certain things, it can make certain claims. Now, let's talk about things like acne, eczema, dermatitis, rosacea, dandruff, even depression, anxiety. These are all either diseases, conditions, or side effects of a disease or condition, right? So by the FDA's laws, anything that talks about those cannot be a cosmetic. It has to be OTC. And over-the-counter specifically talks about treating, diagnosing, preventing, mitigating, or managing any of these things, or something that changes the biological system of a human. So for instance, if I put on, let's say that I put on let's say that I put on salicylic acid. Salicylic acid helps to break down the glue in the skin that causes acne. Salicylic acid can help get rid of breakouts. That is changing the skin's biological system, and it is treating a condition. acne. So therefore, that has to be labeled as an OTC product, and it has to be labeled very strictly, and it can only contain certain ingredients. And this is great because it keeps us safe. But as mentioned earlier, sometimes there are issues with a new ingredient that comes onto the market. Let's say that it was proven in medical literature that menthol can stop pain, or it's proven in medical literature that retinol or retinaldehyde can help get rid of acne. The FDA doesn't have it on their acne list, so you cannot claim that that product fixes, cures, treats, or mitigates that condition. A really good example of this is an anti-aging product. If I've got a product that's a cosmetic, I can say it reduces the appearance of fine lines. That's not claiming anti-aging. It's saying reduces the appearance of fine lines. To the consumer, it kind of means the same thing, but no, it's different. Whereas if it actually says it's anti-aging, or it reduces wrinkles, or it does reduce fine lines, that all of a sudden becomes an OTC claim. So do you see how that one word can reduce or reduces the appearance? You see how that makes such a difference? Hello, birdie. That is what is really interesting, and that actually gets into the second part when it comes to how these are marketed. Companies can get in a lot of products if they, company products can get in a lot of trouble if they don't do this right, and that's a good thing, correct? The issue is that companies try to find sneaky ways around this. Now, you hear this all the time in the beauty industry, you see this all the time in marketing, and you even hear it from me because girl's not trying to get her butt sued, right? But if you hear a company saying that this can reduce fine lines or wrinkles, or this can help with the treatment of acne, or this can help with depression or anxiety, that's not making a claim that it will, it can. Okay, cool. And that kind of protects a little bit. Now, as an individual, it's a little bit easier because I'm an individual, everything I say is my opinion. But as a cosmetic company, if you're making those claims, it's a pretty big deal, you know, and that's to keep us safe. That is a good thing. Now, when it does come to these claims, this is also kind of why we've seen a lot of influencers talking about things. Now, this is not official, this is a girl's personal opinion, but I have noticed that influencer marketing blows up because you have a higher ROI, return on interest, than you do from a TV commercial. You see a TV commercial, I'm not going to remember to buy this at the store. Good luck to get me to go to the store. If an influencer tells me that she loves this, if I trust her, she has the link right there in her description, it's a lot easier for me to add to my cart, right? Influencer marketing makes sense for other reasons. But influencer marketing, I think, is also being used a little bit sneakily. For example, a company can hire an influencer and can tell that influencer, did you know that this has been shown by other people to improve the appearance of fine lines and wrinkles? And the influencer is like, oh, really? And she tries it, and if she's honest, she'll give her honest opinion and explain how it worked for her and say, look, it cleared my fine lines and my wrinkles. Fine. That's her opinion. But if she's dishonest, or if she's just reading, you know, off of a sheet that these company manufacturers gave to her to say, or this brand gave to her to say, she might say it reduces wrinkles, it reduces fine lines, it contains all organic ingredients. You see that that's a problem? It might contain 1 or 2 organic ingredients, but it doesn't contain all organic ingredients. And at the end of the day, it may be an awesome product, but you see how the influencer, not being bound by the same laws and regulations that the company is, starts saying things that he or she or they believe is true, but that might actually misrepresent the product slightly as according to the laws given by the FDA. So as a consumer, I want you to be aware of this, and I want you to actually you can make it like a shot game or something. Every single time an influencer says can as opposed to will. Do this with me. I say this all the time because, again, I'm not trying to treat or diagnose. I don't have a degree in which I can do that, and even if I did, I would not want to do that over the internet, and that's not my realm. I must stay in my own lane, right? But look back at some of my videos and see how often I say this can help with, or this can treat. If you say anything else, you're gonna get in trouble, and that's just how it is. The next thing I want to talk about is the fact that sometimes there are natural ingredients, natural derivatives, or lab-created derivatives that are so much better than the things that the government allows you to put on the bottle and at treating a specific condition, but the government will not allow you to do it. Let's take an example because that sentence was kind of confusing. Let's take acne. We know that salicylic acid and benzoyl peroxide are always on our labels. there could be an ingredient that is out there that is way more efficacious at removing acne. We're talking things maybe like can help, like retinol or retinaldehyde, or even for some people if they're using an essential oil like tea tree oil. Medical literature has proven these things to be beneficial for acne. Medical literature has even proven matcha to be beneficial for people who have ADHD or who have neurological processing or anxiety disorders. Matcha, in some studies, seems to work better than some prescription drugs. But guess what? Those prescription drug labels from the FDA and those lists have not been updated since the 1980s or from the 1990s or from the 1970s. So even if retinol works on acne, even if, some sort of product or natural tea tree oil works on acne or wrinkles, they are not allowed to put that on the bottle, and they cannot even say that the product helps with that. Otherwise, they're going to get their asses sued, and the FDA is going to come in and do what the FDA does and either fine them or shut them down. And this is kind of frustrating because science and technology are updating things so quickly. I feel like we should know what's going to work for us, and this is also why I'm a huge proponent of you reading your labels. Know what those ingredients are. So even if the FDA doesn't get around to regulating something for another 50 years, you can at least understand what these ingredients are and know if they are safe, if they are harmful, if they have been shown by medical literature to help with something like acne or rosacea or dermatitis or eczema. Otherwise it just becomes a waiting game for us to wait for the Food and Drug Administration to get around to things. And as this airplane passes overhead, rude, as it does that, I also want to talk about how the FDA has gone a little bit wrong, in my personal opinion, which is with its labeling and with the amount of ingredients that it has banned. So Europe has banned over 1,300 substances in cosmetics and in our beauty products and food products to keep us safe. Canada has banned over 600. How many has the US banned? 11. And this is frustrating because obviously there are a lot more than 11 products that can do major harm. The European Union has found 1,300. Why has the US government not updated this? The truth is, they just haven't since 1938 or maybe the 1950s. And these laws are 80 years old. And we're expecting the government to take care of us, but they're not even updating these things. And why? Because there's no legislation. Food has been updated, cars have been updated, electronics have been updated, chemicals, pesticides have been updated in agriculture. But for some reason, cosmetics haven't. So this is where the FDA is kind of, in my personal objectionable opinion, it's leaving us out to dry, right? And that's not really fair. And then also, like, when it comes to sunscreens, this is a huge topic right now because if you've watched this channel, you know that there's some drama about sunscreens, specific chemical sunscreens being absorbed by the bloodstream, specifically avobenzone, oxybenzone. It's an issue, and the FDA is, thank God, looking into it. But the other problem with sunscreens is those labels. Just because it says SPF 30, does not mean that you're protected 30% from the sun. And SPF 30, I think, blocks like 92 or 94% of the sun's rays. But what that number on the sunscreen label does is tell you how long you can stay in the sun without burning. So in SPF 30, if you normally go out in the sun and you burn in 10 minutes, SPF 30 will give you 30 times longer before you burn. Like, I shouldn't have to do math to go to the damn beach, okay? But the FDA makes these things so confusing. Sunscreen laws are so hard to understand, so hard to wear. You have to reapply them every 2 to 3 hours. The government does not take care of us in a way that makes it easy for us to know what's in our products. And that's why I want you to be educated. Now, this is the hitter, and this is when it comes to acne, and this is where it makes my blood boil. Ooh, we got an angry Cass on the run in the wild. When it comes to acne, there are 3 ingredients that the FDA has allowed for the clearance of acne, and as of 2016, they have added 1 more. Can you guess what those are? Salicylic acid, benzoyl peroxide, and sulfur. The one that was added in 2016 is a special case. A company owns it, and I want to talk about companies and patents and intellectual property in another video, or this video, I don't know. But this is frustrating AF, and let me explain why. We do know that by medical literature that benzoyl peroxide, sulfur, and salicylic acid can help with acne. This is awesome. But guess what? These all were proposed and regulated in the 1980s, and I think officially approved in like 1989 or 1991. They have not been updated since then. All right, there's also a combination. If you combine sulfur with resorcinol, or resorcinol monoacetate with sulfur, those are two combinations that you can use for acne in over-the-counter products. But otherwise, these are the only ones. And again, they're very strict about what you mix them with, how much is in there. You ever notice that you only see salicylic acid from 0.5 to 2%? That's because it's what the FDA labels. You ever see benzoyl peroxide in only 2.5 to 10%? It's because the government set that out there. Now, this is great. It keeps us safe. But guess what? Since the 1980s, there have been a lot of advancements in dermatology and in skincare. We now know from medical literature that retinaldehyde can help with acne, can help with blackheads. We now know that tea tree oil can help. We now know that a lot of these other substances can be beneficial for acne. But guess what? If you have those in amounts on your product that can clear somebody's skin to the moon and back, you are not allowed to say that that is an acne product. You cannot say this product helps to clear acne. You cannot say that this product fights pimples. You cannot say that this product gives you eczema relief if it's got some hyaluronic acid and some sort of, beautiful natural blend. And this is frustrating because a lot of these new advancements are saving people's skin. They are transforming lives. If you have acne or rosacea or eczema, or if you live with something that lives on your skin, that impacts how you view yourself and how you present yourself to the world. And if we had products that could help us, hell, we'd want to know about them. But the FDA's laws prevent us from knowing about them because all these companies, some of these companies could put the best ingredients in there that are clearing people's skin to the moon and back. But that company would never be able to state so unless the government updates their laws and regulations, which again, they haven't done in forever. Really frustrating. I want you to read your labels. Again, this does prevent companies from saying bad things and being like, oh, this has grass and human urine, it's gonna clear your acne. No, it's not. Shit, Sherlock. But so it's good that it protects us from that, but it is bad in the sense that it's kind of leaving some of us out to dry if we don't know how to read our labels, if we don't know what glycolic acid does, if we don't know how to use these things. Now, there is one exception, which is Differin, which is adapalene gel. Now, this is where it's interesting. This was approved in 2016, and this is owned by a company. We're gonna have, this video's long. We're gonna have to talk about cosmetic labeling and manufacturing and patents in another video. But there's something called intellectual property. If I create a bottle that is revolutionary, for instance, this looks like toothpaste and it self-dispenses, that is my intellectual property. I can then patent that and I can own it. In specific cosmetic manufacturing, it goes for like 10 years. This is a lot of drugs as well. If you ever notice, drugs in America are approved. They're 6 times more expensive than anywhere else in the world. 10 years later, India gets them. Not meant to be a political statement. I'm just saying the facts. Why does India get them 10 years later? Because that's when the patent, aka the ownership, runs out. Companies go about taking biological substances, and you cannot patent a biological substance. Anyone can get this. I can't own this. But if I modify this in a way that just changes it a little bit, I can now say that this is my intellectual property. It's special on a chemical or molecular level. I can then put it into a drug and charge whatever I want. I have to make sure in the drug sense that I go through testing to make sure that it's safe. There's a whole bunch of laws around that as well about drug testing and drug approval. But essentially that's what a patent is. It's owning something. So Galderma Industries, which is now owned by Nestle, who full disclosure, I partnered with them in the past. It did not go well, not because of them, but because of who I was working with, my manager, who I fired. Long story. But full transparency, just so that you know about why I understand some of these things, or if you want to say that I have a bias, I don't feel that I do, but I think that it's important to state that I had that was a part of my history. So Galderma, owned by Nestle. Galderma they're a pharma company, and they own a bunch of different products. They own a bunch of different ingredients, and they own a bunch of different patents. And one of them happens to be adapalene gel, otherwise known as Differin. If you've ever gotten a prescription for Differin or Epiduo like 5 to 10 years ago, this is a patented biologic, something that they made, so it's special to them, that they put in a product and they proved for safety and they sold as an acne product. Again, RX, you could only get it from a doctor. Well, the patent was about to run out. And when the patent runs out, it becomes available to everyone. You ever notice that glycolic acid took over in the past couple years? We never heard of it before. It's because it was under a patent, okay? It belonged to somebody until it expired. Well, theirs, I think, is still under their patent, but they pushed and paid a lot of money to the FDA to say, we want this to be over the counter. Instead of just prescription, we want it to be over the counter. And I'm glad that they did that, because this is an ingredient that has been medically proven to help people with acne. It's frustrating that it's only one. It's frustrating that it is it's owned by this one company, but they have the money to do that. You know how much money it takes to get the FDA to do something? They are slow mofos. Benzoyl peroxide, it took them like 5 to 10 years to even accept. Like it takes forever. So that is the one exception. That's great, but it's also only owned by Differin. So if you see adapalene gel in anything else, you can't say that it controls acne because it's not owned by Differin, right? So that's what's up. That's kind of how this goes. When it comes to other cosmetic laws like stability testing, did you know that not all cosmetic companies are required to stability test their products? A lot of companies do it out of the grace of their own hearts, but you're not required to. There's a lot that goes into the business of beauty, and if you want to talk about it, let me know. I want you to be educated consumers so you know how to read your labels, you know what's good for you, and you can make safe, healthy decisions if other regulatory bodies or government bodies or other systems are not protecting you in the most efficacious way that they could. Again, this is all my opinion. Everything can happen. Anything can happen. A little fairy could come down and take me off to Timbuktu and we could go ride horses in Narnia. Could happen, right? If you want to watch a video that I did on the real price of beauty, for instance, why cosmetics cost as much as they do, you can watch that here. And if you want to see another more interesting beauty and science video on how to read your skincare labels, you can watch that here. I love you. Remember to be beautiful inside and out. Get inspired by information like this and make good decisions for you. Love you guys. Bye.